All right, let's talk about a drug that absolutely changed the game in medicine. It's a pioneer, it's a lifesaver, and, it's also a little bit of a troublemaker. This is the biography of erythromycin. So here's our game plan. We're going to start with its super humble beginnings, literally, in a pile of dirt. Then we'll see how it sabotages bacteria from the inside. And after that, we'll get into the really tricky parts, the side effects and the dangerous drug combinations that really define its complicated legacy today.
To really get why erythromycin was such a big deal, you have to look at the timeline. Penicillin kicked off the whole antibiotic revolution back in 28, but hey, not everyone could take it. So when 1952 rolls around, this new hero emerges, discovered as a vital alternative for anyone with a penicillin allergy. Which brings us to its origin story, which is just incredible.
I mean, get this. This powerful antibiotic wasn't cooked up in some sterile lab. It was discovered, literally, in the earth. Scientists found it in a bacteria from a soil sample collected in the Philippines. A true natural wonder.
So how does this molecule, born from the soil, actually fight off infections? Well, it turns out its strategy is a brilliant and really targeted act of sabotage.
Okay, so think of a bacterium as this tiny little factory, just constantly churning out proteins to survive and multiply. Erythromycin basically sneaks in, latches onto a critical piece of machinery, the 50S ribosomal subunit, and just throws a wrench in the gears. The whole assembly line grinds to a halt, and the bacterium can't build anything it needs to grow.
And here's the crucial point. This makes erythromycin bacteriostatic. It doesn't usually go for the direct kill. Instead, it just freezes the bacterial invaders right where they are, stopping them from multiplying. This gives your own immune system the perfect chance to swoop in and clear out the stunned enemies.
So we know how it works, but what does it actually work against? See, erythromycin isn't a shotgun. It's more like a sniper rifle with a very, very specific hit list.
It's an absolute powerhouse against common stuff like strep throat, and it's especially good against those atypical bacteria, the kind that causes walking pneumonia. And for whooping cough, it is still the #1 go-to drug of choice.
All right, now let's talk about how our bodies actually handle erythromycin, because this is where the journey starts to get, well, a little bumpy.
One of the reasons its effects can be so unpredictable is absorption. The raw drug gets destroyed by your stomach acid, so it comes in these different salt forms. But here's the catch. With one type, if you take it with food, you absorb way less of the drug. With another type, food makes no difference at all. So you can see how getting a consistent dose becomes a real challenge.
And then there's the gut. Erythromycin is absolutely notorious for causing these gastrointestinal side effects. In fact, this is probably the #1 reason people have to stop taking it. It can be really, really rough on the stomach.
And here is the fascinating reason why. This isn't just some accidental side effect. Erythromycin actually mimics a natural hormone in our gut called myelin, the very hormone that tells our digestive system to get moving. So the drug is actively pressing the accelerator on your gut, which, leads to all that cramping and discomfort.
This brings us to probably the most critical safety issue with erythromycin, and that is how it plays, or really doesn't play, with other drugs.
This one sentence right here is the key to understanding all the dangers. That enzyme, CYP3A4, it's like your liver's main garbage disposal system. It breaks down dozens and dozens of common medications. What does erythromycin do? It comes in and slams the brakes on that entire system.
And the real-world consequences of that are serious. I mean, deadly serious. When that disposal system shuts down, other drugs can build up to toxic levels in your body. So if a patient takes it with a common statin for cholesterol, they risk severe muscle breakdown. With a blood thinner like warfarin, the risk of a major bleed just skyrockets. The stakes here are incredibly high.
But the most feared interaction is what it can do to the heart. It can actually disrupt the heart's electrical cycle, an effect we call QT prolongation. This can trigger a chaotic, potentially fatal arrhythmia. So this isn't some minor concern. It's a critical safety risk that doctors have to manage very carefully.
So you're probably thinking, with all these side effects and dangerous interactions, is there even a place for erythromycin in medicine today?
Well, the answer is yes, but it's become a highly specialized tool. While newer antibiotics handle a lot of the common infections, erythromycin is still the best choice for whooping cough and a crucial backup for strep throat in patients with penicillin allergies.
And in this really fascinating twist, that gut-churning side effect, we now use it on purpose to treat conditions where the stomach empties too slowly. The problem literally became the solution.
So when you look at the whole picture, erythromycin is a true medical pioneer. It started out as a frontline wonder drug, but it's since settled into a new role. It's now this indispensable niche player, a powerful reminder that in medicine, even older tools can be incredibly valuable, as long as you know exactly how and when to use them.
Which kind of leaves us with a final thought to chew on. As we face this future where our best antibiotics are starting to fail, the story of erythromycin, its unique mechanism, its targeted uses, even its side effects, it really makes you wonder what other secrets might be hiding in our oldest medicines just waiting for us to rediscover them.